Hi guys, welcome. Today I will be sharing a couple things I would tell my younger new grad nurse self getting into the nursing career or nursing profession. This is what I would have told myself then. Number one is that you'll make mistakes. Yeah, shocker, right? Um, like as a nursing student, especially when you're still with your preceptor and like under the guidance of your nursing instructors at clinicals mostly, you don't get to do a lot of other tasks aside like the clinical piece of things. So basically you're trying to learn how to do an IV, you're trying to learn how to do a wound dressing care, but you're not really involved in all the other admin tasks that nurses end up doing. So by the time you get into all of that and have a full workload on your own, yeah, it can be a lot and you will make mistakes. But the thing with getting through them is owning your mistakes, taking responsibility for them, getting more education as needed, and also recognizing that the mistakes are learning curves that are going to make you a better nurse. So instead of drowning in your mistake and using that as an identity that, oh, I'm a bad nurse, I'll never make a good nurse, blah, blah, blah. Oh my gosh, maybe I just chose the wrong profession. Use those mistakes instead as learning curves to become a better nurse. The other thing is don't be afraid to try new things. You don't really, in nursing school, you do a couple clinical placements that would shed more light, or a couple clinical placements that would give you exposure, and in those moments you kind of find out what you might like or what you might not like. But try more things as you get out and into the nursing field itself. Good thing is that you don't need to do a lot of certifications to try other places. Most of the time it's just like an orientation for 6 weeks or something, and then you're good to go on that new unit. But try it so that you figure out what works. Med-surg might not work for you, labor and delivery might not work for you, surgery might not work, but just try different things because that's the only way you can actually find out what will work for you. And also don't feel terrible when a unit doesn't work out. So you might be a medical surgical nurse, that's the first thing that you're starting out as, and hate it then, completely hate nursing, and then you move on to a different ward, so you move on to surgery and you don't mind it at all. Do you understand what I'm saying? So like try different things. And it's very normal that you're going to doubt yourself in your early days. That's a very normal feeling. It's a new terrain. A lot of people feel that way. I'm sure a lot of new graduates feel that way. That's okay to have those feelings. But again, give yourself grace that you're getting through this. It's a new journey for you. You're just learning it and ease into it. So give yourself even about 6 months or a year to actually adjust into, feeling confident as a nurse. All the experienced nurses that you look at were once in your shoes. The other thing is, it might be tough adjusting to 12-hour shifts, but you will love it. Oh my gosh. And this is relative, by the way, because again, depending on the phases of people's lives, some people love 12 hours, some people absolutely hate it. But you get used to it in a way, like once you start to do it for a while. And sometimes you're like, how do people cope 9 to 5? I remember like having to like switch to 8 hours for 2 weeks for an orientation. I was just like, I don't enjoy this because I could only get the weekends off, and I like getting time off in between the week to just do my thing when just, every other person has gone to work, but it's just me. So yeah. So you need a debrief buddy who gets it. I don't know how to explain this to you, but you need somebody who understands the nursing lingo, who gets it, who's like, yeah, you're overworked, like it's not as glamorous as it seems on the outside. Of course, it's a privilege to be involved in people's care, but that also gets the hard part of it. So like the banter that can ensue amongst nurses, or like the drama, or like just things, somebody who understands. You definitely need a debrief buddy, because there's some things you're just like, I don't want to have to break it down. I just need somebody who understands that when I say PT, I mean patients, who understands when I say oxytocin, they know, like, who gets it, you understand? So yeah, you need a debrief buddy, or you need a debrief buddy. So I also have an Instagram page that I just started, which is at nursebuddy_body, as in BUDDIE, and it's just to accompany nurses the first few years of adjusting into a new career. So feel free to follow me. And yeah, there's more goodies coming your way. That's gonna be a page where if you feel lonely, feel tired, if you need to rant, that's your page, and you go to page 2 to go and pour your heart out, because that's what we're gonna be doing, supporting and like holding each other throughout our careers. We're going through it. You can create your path in nursing, so don't feel like you have to limit yourself to what it just looks like traditionally. So that's why you have to like follow people, ask questions that where get to know what people else are doing, what people are actually doing outside. Follow pages on Instagram that can inspire you or to show you like, okay, this is not the only traditional pathway, like show you multiple pathways with your nursing license. So feel free to do that as well. It's also okay to say no to like extra work shift, no to being assertive. And when I mean no, like even to be more assertive. So like if you've not had your breaks and you're the only one constantly being pulled to do this, to do that, to do that, and every other person is chilling, be able to say no, like that person's chilling, I need a break. So it's harder at first, but over time, as your competence and confidence builds, you're going to get into it. And your confidence again only builds with a lot of practice and exposure. So that's why your mistakes should be like learning curves, not where you shrink, but I can do this and I will get to it. Also, incorporate time to relax. You absolutely need to be able to chill, because nursing can suck the life out of you. So you're like finishing your night shifts, maybe 3 night shifts in a row. Your 4th night that you're off, you're sleeping the entire time. You're just like done. You really just want to just be on your own. You don't want to hear a lot, and it can be hard to like engage and keep up, but just try as much as possible to incorporate relaxation time with family. You don't have to work every holiday. You can take a break, like it doesn't always have to be an overtime shift, especially if you prioritize family. But I mean, if you're single, you don't have all of these commitments, you don't have family around or whatever, and you choose to do that, that's also fine. But just find time to be able to renew yourself, because it can be quite draining. And a lot of people get burnt out because we're not even going to get into that. It can just be quite draining. Okay, so just make time for the things that actually like fill you with life, you know what I'm saying? In all, this is what I would tell my new grad self: to just keep pushing. And at first you're going to be like wobbly, like learning how to walk as a child, and then eventually you're going to get there. So that's it.